Stop everything for just a moment and ask yourself this. Could your blood pressure right now be quietly putting your heart, your brain, and even your life at risk, and you do not even know it? I am serious. Every year, millions of seniors follow outdated advice about blood pressure, thinking they are safe, yet their numbers are silently stressing their bodies in ways that could lead to serious complications. Today, I am going to reveal exactly what blood pressure numbers you should really aim for, why most of the advice you have heard might be outdated, and the simple steps you can take starting today to protect yourself. Stay with me, because the first secret I am about to share will completely change everything you thought you knew about your health. Here is the first thing almost nobody tells seniors, the perfect 120/80. That gold standard you have heard about all your life may not actually be ideal for your age. That is right. As we age, our bodies change, arteries stiffen, hearts beat differently, and forcing your numbers down to what was normal decades ago can sometimes do more harm than good. You may even feel dizzy, weak, or fatigued if you push too hard. Let me explain why this happens. Your body is an incredible machine, and it adapts over time. Blood vessels naturally lose some elasticity as we get older, and if your blood pressure is too low, your organs may not get the oxygen and nutrients they need. That can lead to falls, confusion, and even dangerous heart problems. So for many seniors, a slightly higher reading, say 130 to 140/70 to 80, can actually be safer than trying to hit 120/80. Counterintuitive? Absolutely. But this is the kind of information most people never hear. Now let me ask you something important. How often do you check your blood pressure at home? If your answer is rarely or only at the doctor's office, you might be missing the full picture. Blood pressure is not a static number. It fluctuates throughout the day depending on meals, stress, activity, and even the weather. Your one visit to the clinic is like taking a single photo and assuming it tells the story of a full movie. To truly understand your blood pressure, you need consistent readings over time. Here is something you may not know. Your medications, even for unrelated conditions, can affect your blood pressure. Arthritis medications, cold remedies, allergy medicines, even sleep aids, these can all subtly raise your readings without you realizing it. That is why self-awareness is key. Understanding your numbers is more important than blindly following generic guidelines. Let's talk about lifestyle, because this is where most seniors underestimate the power they have. Walking 20 to 30 minutes a day, eating more vegetables, reducing processed foods, managing stress, and staying hydrated can dramatically improve your blood pressure. And here is the truth, it is never too late. Even if you are in your 70s or 80s, making these small, consistent changes can protect your heart, your brain, and your energy levels. Stress is another silent contributor that many seniors overlook. Chronic stress keeps your body in a constant fight-or-flight mode, subtly elevating your blood pressure day after day. Simple practices like deep breathing, meditation, or even taking 5 quiet minutes a day can have a profound effect. Social connection, hobbies, and mental engagement are equally important. Blood pressure is not just physical, it is emotional and mental too. Here is a question I want you to think about. How often should seniors check their blood pressure? The answer may surprise you. Daily readings at different times of day are ideal. Record your numbers, notice how you feel, and share these trends with your doctor. This is not obsessing over numbers, it is taking control of your health. When you know your unique numbers, you are empowered to prevent complications before they happen. Let me tell you a story about my friend George, 72 years old. George was always told his blood pressure was fine, around 140/78, so he assumed he was safe. But he started tracking his numbers at home, and over a few weeks, he noticed spikes that coincided with stress, certain meals, and late afternoons. By making simple changes, walking after meals, reducing salty snacks, and practicing 5 minutes of deep breathing twice a day, George's readings stabilized. Today, he feels more energetic, alert, and confident. This is not an unusual story. This could be your story too. Another thing seniors rarely hear about is the one-size-fits-all approach. A reading of 135/75 might be perfect for one senior, but slightly high for another. Your heart health, kidney function, medications, and overall activity level all influence what is safe for you. That is why personalized targets are now the gold standard in modern medicine. And the best part? You can start finding your personal safe range today with simple tracking and guidance from your doctor. Now, do not panic if your readings are a little higher or lower than expected. Occasional fluctuations are normal. Persistent high readings or worrying symptoms, dizziness, chest discomfort, or shortness of breath require attention. But for most seniors, the power is in tracking trends, adjusting lifestyle habits, and understanding personal patterns. This is how you gain true control over your blood pressure. Here is another life-changing tip. Invest in a reliable home blood pressure monitor. Taking readings at the same time each day, sitting quietly for a few minutes before measuring, and recording your numbers is one of the smartest things you can do. Over time, you will notice patterns. Maybe your pressure spikes after salty meals, drops after a walk, or rises during stressful phone calls. This information is priceless because it gives you the data to make informed decisions and have truly personalized conversations with your doctor. Let me share another story. Martha, 75, had been taking her medications faithfully and assumed her blood pressure was under control, but she started feeling lightheaded in the mornings. By tracking her numbers at home, she realized her pressure was dropping too low overnight. Her doctor adjusted her medication schedule slightly, and within a week, she stopped feeling dizzy and regained her confidence. Small changes based on careful tracking can have a huge impact, and this is why home monitoring is essential for seniors. Now let's talk about diet, because this is where many seniors can make immediate improvements. Reducing processed foods, cutting back on salt, increasing vegetables, fruits, lean proteins, and healthy fats can dramatically lower blood pressure. Even moderate changes like adding a daily walk, switching to whole grains, or drinking more water can make a difference in just a few weeks. And the best part? These changes also improve energy, mood, and overall health. Another often overlooked factor is sleep. Poor sleep can elevate blood pressure, sometimes without you even realizing it. Seniors who get 7 to 8 hours of quality sleep per night tend to have more stable readings, better memory, and stronger immune systems. Small steps, like reducing caffeine, keeping a regular bedtime, and limiting screen time before sleep, can make a huge difference. Stress, again, plays a silent role. Chronic worry, family pressure, or even feeling isolated can keep your blood pressure elevated. Social connection, hobbies, and mental engagement are as important as diet and exercise. A senior who stays socially active, laughs, and engages in meaningful activities will often have more stable readings than someone who is isolated, even if both follow the same diet and exercise plan. Here is the bottom line. Blood pressure is more than just a number. It is a window into your cardiovascular health, brain function, and overall well-being. Understanding it, tracking it, and managing it with lifestyle and medical guidance can prevent complications, improve your quality of life, and give you peace of mind. There is no single perfect number for all seniors, but there is a number that is perfect for you. Take action today. Start tracking your blood pressure at home, review your lifestyle, make small changes, and have a conversation with your doctor about your personal safe range. Blood pressure does not have to be a mystery. The truth is out there, and now it is in your hands. Remember, every small step counts. Walking after meals, reducing salt, practicing stress-reducing exercises, staying socially connected, getting quality sleep, and tracking your readings can combine to create massive improvements in your health. And the most powerful step? Awareness. Knowing your numbers, understanding your trends, and acting on them puts control back in your hands, and that is the key to living longer, healthier, and happier. By following these tips, you are not just managing numbers, you are protecting your heart, your brain, and your life. And it all starts with one simple decision: to pay attention, to take control, and to act today.